We go outside of healthcare to see our system in a new way and get fresh ideas for improvement. Today we're going to learn about a safety system to handle a totally different hazard, one we rarely face in healthcare. We're going to look at dangerous snakes.
Hi, I'm Kathy Duncan, and today we're going outside of healthcare to the Central Florida Zoo.
The Central Florida Zoo has a lot to teach us about safety. Specifically, we're going to learn 3 valuable lessons about reliability. In order to create reliable systems, we need to prevent failure, identify failures and mitigate their effects, and learn from failure to better design our systems. How does the zoo apply those concepts when handling venomous snakes?
My name is Michelle Hoffman. I'm a reptile keeper at the Central Florida Zoo. I've been here for 4 years and I work with one of the largest collections of venomous reptiles in the southeast within AZA zoos.
Michelle took us behind the scenes to show us how they stay safe when handling snakes, to clean their enclosures and to move them.
The red and the green cage cards actually will tell us at a quick glance if the snake in the enclosure is venomous or non-venomous. So the red obviously is the venomous, the green is the non-venomous, red stop, green go.
And what's this number 1 up there?
The numbers above the enclosures actually tell the keepers how many animals are in the enclosure. So for example, there's only 1 Aruba Island rattlesnake in here and there are 3 pythons in that enclosure. So we know if we open the door and we only see 2 animals, there might be one hiding somewhere, to keep your eyes open and actually find all of those animals before you reach in or before you do any work in the enclosure.
All this helps prevent snake bites. But what if a failure does occur? When keepers handle snakes, they work in pairs so that if something goes wrong, there's a trained person there to help them.
We're expected to work really closely with our coworkers and our managers. We have a very open relationship when it comes to trust and being able to speak up.
They also use a belt clip with key information about the snake, such as the antivenom.
So that way if something goes wrong, somebody can come in from the outside, know exactly how to handle the situation and which antivenom to bring with you to the hospital.
This helps to reduce harm if a failure does occur. The next principle of reliability is that you may redesign your systems based on what you've learned from failures.
It's been over 20 years since we've had a venomous snake bite here at the Central Florida Zoo, and one of the reasons for that great track record is because we were always adapting and adjusting and learning how to improve our systems to prevent any failures in the future.
For example, they used to use a lanyard instead of the belt clip with all the snake information.
We actually switched it to the belt clip in order for it to be completely out of our way and not in any sort of position where it could get attached on anything or a snake's tail could get hooked around it or anything like that.
They also modified their trash barrel to have a plexiglass window on the top so that they could see where the snake is.
One of the main ways that we do learn is from other people, other facilities, other reptile professionals. So we are expected to have close relationships with those colleagues. If we have a system that maybe went a little bit wrong or that maybe wasn't working out the best, we can go to them and ask for advice without feeling like we're inferior or something like that.
Every time I visit the zoo, I see opportunities to standardize, mitigate failure, and even redesign the work. But they've taken opportunities to really look at how they can keep not only their keepers safe, but they can keep their animals safe. So as you go about your daily work and daily life, look at other opportunities to really see how you can bring things back to healthcare.